Advanced Urogenital System Block for 7th semester medical students. The Advanced Urogenital System Block is designed to provide an in-depth understanding of the anatomy, physiology, pathology, diagnosis and management of diseases affecting the urogenital system. The primary focus is on disorders of the urinary tract and reproductive organs, in both males and females, as well as emergency approaches related to this system. 1. Anatomy and physiology of the urogenital system. Anatomy of the urogenital system. Urinary system. Urinary tract, kidneys, cortex. Contains glomeruli for blood filtration. Medulla houses tubules for urine concentration. Ureters, tubes transporting urine from the kidneys to the bladder. Bladder, a urine storage organ with an average capacity of 400 to 600 milliliters. Urethra, a passage for urine excretion, longer in males, also functions in the reproductive system. Male reproductive system. Testes produce sperm and testosterone. Epididymis, site of sperm maturation. Vas deferens, transports sperm. Prostate and seminal vesicles produce seminal fluid for sperm. Penis, organ of copulation. Female reproductive system. Ovaries produce ova and hormones, estrogen, progesterone. Fallopian tubes, site of fertilization. Uterus, implantation site for the embryo and fetus development. Vagina, birth canal and organ of copulation. Vulva and clitoris, external genitalia. B. Physiology of the urogenital system. Kidney functions. Glomerular filtration. Filters blood to form urine filtrate. Reabsorption. Returns water, glucose, and electrolytes to the blood. Secretion. Excretes substances like hydrogen ions and urea. Blood pressure regulation. Through the renin-angiotensin-aldosterone system. Erythropoietin production. Stimulates red blood cell formation. Urinary tract functions. Urine storage. In the bladder with sphincter control. Urine excretion. Through the urethra. Reproductive functions. Male. Spermatogenesis in testes and sperm ejaculation. Female. Ovulation, menstruation, fertilization, and pregnancy. 2. Pathology of the urogenital system. The block covers various diseases affecting the urogenital system, including a urinary system diseases, urinary tract infection, UTI, causes. Bacteria such as Escherichia coli. Symptoms: painful urination, dysuria, hematuria, frequent urination. Complications: pyelonephritis, sepsis. Kidney stones, urolithiasis, causes. Crystallization of calcium oxalate or uric acid. Symptoms: colicky flank pain radiating to the groin, hematuria. Complications: ureteral obstruction, infection. Acute and chronic kidney failure. Acute, sudden decline in kidney function due to shock, toxins, or obstruction. Chronic, progressive, often caused by diabetes or hypertension. Kidney and bladder cancer, kidney cancer. Typically adenocarcinoma, bladder cancer, often linked to exposure to carcinogens, e.g., smoking. Glomerular diseases, glomerulonephritis. Inflammation of glomeruli due to streptococcal infection or autoimmune disease. Nephrotic syndrome. Protein loss in urine due to glomerular membrane damage. B. Male reproductive system diseases. Benign prostatic hyperplasia, BPH, enlargement of the prostate causing urinary obstruction. Symptoms: difficulty urinating, weak urine stream. Prostate cancer. Risk factors: old age, family history. Diagnosis: rectal examination, PSA, prostate-specific antigen. Male infertility. Causes: impaired spermatogenesis, sperm transport obstruction. Orchitis and epididymitis. Inflammation of the testis or epididymis due to bacterial or viral infection, e.g., mumps. C. Female reproductive system diseases. Endometriosis. Growth of endometrial tissue outside the uterus. Symptoms: painful menstruation, infertility. Pelvic inflammatory disease, PID, infection of the female reproductive organs due to bacteria. Symptoms: lower abdominal pain, fever. Cervical cancer. Cause: human papillomavirus, HPV, infection. Diagnosis: Pap smear. Female infertility. Causes: polycystic ovary syndrome, PCOS, tubal obstruction. 3. Diagnosis of urogenital diseases. A. History taking and physical examination. History. Main complaints: dysuria, hematuria, pelvic pain, menstrual disorders. Family history, urinary patterns, sexual activity. Physical examination, abdominal examination, kidney tenderness, bladder distension. Genital examination, testicular masses, vulvar abnormalities. B. Supporting examinations, urinalysis, checks for blood, protein. Leukocytes or crystals in urine. Imaging studies, kidney and bladder ultrasound. CT scan for kidney stones or cancer. Laboratory tests, urea and creatinine for kidney function. PSA for prostate cancer. Endoscopy, cystoscopy to evaluate the bladder. Fertility tests, semen analysis for men. HSG, hysterosalpingography for women. 4. Management of urogenital diseases. A. Pharmacological therapy, antibiotics, for UTI, PID, or orchitis. Symptomatic drugs, alpha blockers for BPH. NSAIDs for endometriosis pain. Hormones. Hormonal therapy for infertility or endometriosis. B. Non-pharmacological therapy. Diet and lifestyle. Low oxalate diet to prevent kidney stones. Avoid alcohol and smoking. Non-invasive procedures. Lithotripsy to break down kidney stones. C. Surgical interventions. Prostate resection for BPH. Hysterectomy for advanced cervical cancer. Nephrectomy for kidney cancer. 5. Practical training in the Urogenital System Block clinical case simulations. Developing diagnostic and management plans for UTI, kidney failure, or infertility. Minor procedures. Urinary catheterization. Prostate biopsy collection. Imaging interpretation. Analyzing ultrasound or CT scan results of the kidneys and reproductive organs. 6. Psychosocial approaches and patient education. Preventive education. Avoiding risk factors such as dehydration and unhealthy diets. HPV vaccination for women. Psychological support. Counseling for infertility patients or cancer survivors.